Morning, Nick Jason here. Have a lovely day in paradise. Look, I want to talk about a few things that are different, and I've had a very interesting couple of weeks and signed quite a lot of customers. And they are in biotech, the immune part of biotech, the AI diagnostics part of biotech, very interesting, and also in bioware. This is biofeedback sensory materials, and yes, it's stuff that's been in the lab probably for the last 15 or 20 years that's now becoming a commercial reality. And like I do with most of the things I get behind and help with, either sort of putting them in front of our family offices, or co-investing, or becoming a sort of a board advisor evangelist, I like to try the product and service. And I thought it'd be worth touching on what I've actually tried. So I've got a client that does what's called microvascular testing, and this is where they stimulate the very small capillaries and the blood vessels in your sweat glands, that's in your fingers and toes. And it's a test that takes about 20-25 minutes. It's non-invasive. But the interesting thing is, it's because it's the very, very tiny blood vessels, it detects very early the state of what's going on in your body, almost like your biological age. And it can detect early signs of type 1, type 2 diabetes, cardiovascular disease, all kinds of trauma, and also the long-term effects of COVID and so on and so forth. And I was a bit apprehensive, I must say, before I took the test. And what are they going to find? Because the question that's on all our minds, isn't it, that how long do I have? I'm in my 60s now, and all of a sudden longevity becomes more of a thought. Is there a ticking time bomb? And in actual fact, the data that's coming out of some of the big data sets, Yale Medical and Harvard Med, is that we're all ticking time bombs in a sense. And 87% of people have got an underlying condition that is not detected, is going to kill them. Therefore, it's going to shorten your runway. So why isn't it detected? Well, we know healthcare is more about cure than prevention, and that suits big pharma that feed us with profit-making drugs that give marginal impact on one's health, keep us dependent in a sense. But the macro testing, whereas the test I took was micro, the macro testing is at a different level. It's much, much higher if you think about testing. So EKGs, your electrocardiograph, and other testing around, sort of respiratory and your core systems functions. It's very high level, and they're often testing when there's an underlying condition that's been identified. So they're testing you within a range of normality, I guess. But microvascular testing is catching things really, really early, and that's where it's really enormously valuable, because it is entirely predictive. And we had a few investors take the test, and one gentleman was found to have a heart condition that, if not treated, would shorten his life. And so this stuff is real, and this company is expanding at a rate of knots, as you can imagine, because it's a fundamental test, and makes a fundamental difference to the question that we all have. So anyway, just a thought. It's biotech, AI, advanced diagnostics, huge market, fantastic. Talk soon.